Hello everyone, welcome to my presentation. My name is BERFİN. Today I will talk about the effectiveness of the healthcare systems, a public and private hospital comparison. First of all, since the early years of the Republic of Turkey, every positive development has been closely monitored in the health field and were searched the ways of how reach the more efficient healthcare approach. As seen in the Health Transformation Program, which is implemented in 2003, various attempts have been made for the purpose of ensuring the health of our people and to improve the quality of their life. As a result of such breakthroughs, individuals' confidence and demand to the healthcare system that provides the healthcare services have increased. In our study, hospitals and clinic systems' performance were analyzed by the queuing theory performance scales. As a result of this study, the waiting time in the system has been found to be higher than the private hospitals in the state hospital. On the basis of the examination period, both hospitals and clinics serve in a large part of the time and efficiency ratios at very high levels. Despite of the positive developments in Turkey in the field of the health in recent years, the number of healthcare institutions is a reality that meets the population growth. With the increase in income level, a higher quality service demand arises. The insufficiency of the healthcare institutions, physicians, nurses, caregivers, and suppliers prevent the patient to meet their needs fully. Analyzing the phenomenon of the waiting for service in healthcare institutions, which emerge as a result of the increase in demand with the aforementioned definitions, will increase the effectiveness, efficiency of service units. Today, we see that scientific methods are used more frequently than in the past for the solution of problems in the field of health. Institutions such as the Ministry of Health and TÜKSTAT keep health statistics, measure quality and satisfaction, and publish them periodically. In the academic field, many projects, satisfaction researches, performance and the quality improvement studies are carried out. As a result of these studies, the rights, mistakes, and definitions that arise in the provision of the health services are determined and it's decided to increase the quality and trust environment by making the necessary arrangements. In this study, the service delivery and system performance of two hospitals, one private and one public hospital, operating in Çankırı based on the patients entering into the system, the time they spend in the system, and the time they exit the system were analyzed with queuing theory performance scales. Turkey's healthcare system and other systems made on the queuing theory applications. As a result of incoming requests for the service not being met instantly and inadequacy of service system and the problem of waiting, an accumulance occurs in the service provider units. This congestion is called waiting line or queue. The problem is called waiting line problem or queue problem. Theoretical studies in this direction are called waiting line theory or queuing theory. In which areas are waiting line models used? One of the most frequently used methods in system analysis of enterprises operating in the service sector is waiting line modeling. In the system analysis of food and beverage enterprises, in the service analysis of health institutions, in the analysis of the service performance and the system of banks, in the analysis of service channels in the system such as in ports, tax offices, supermarkets, in the analysis of density levels, in the analysis of variables such as time spent in the system, activity and the number of people waiting in queues, line models are used. Working example where waiting line models are applied. As a result of his study, in which he applied waiting line model in a health institution, he found that randomly created outpatient clinic examination service, inpatient examination service, health board work, and the surgery working hour program in health institution negatively affect the efficiency of the health service provided in hospitals, causing dissatisfaction. On certain days of some months or weeks, excessive intensity and a result of long waiting times and inefficient inspection services were encountered, while on some days excessive isolation was observed. Queuing theory waiting line models, historical development. Historically, John's work titled Waiting Times and the Number of Calls can be seen as the first study in this field. However, the method used in this study was not mathematical method. Therefore, the first mathematical work of the queuing theory was written by A.N. Key, considered to have been built by Erlang. In 1951, David George Kendall published the first work that allowed the calculation of queuing system in cases of the sufficient general input called buried Markov chains. In 1957, Jackson started to research network queuing system and thus laid the groundwork for the studies referred to as queuing network models. David George Kendall was the first person to express the queuing system with the symbols with the article he published in 1953. After this article, in the queuing system research, the symbolization method, which is expressed by Kendall's own name and known as the Kendall notation, has been used frequently. This notation of Kendall was later named A.N. Lee in 1966. And handy in 1968, it was developed by Taha, and Lee added the fourth and fifth symbol, and Taha the sixth symbol. For example, the time between arrivals and service periods are exponentially distributed, the number of service channels is single, the first person to the system receives the first service, the waiting area is only for n units. For example, customer, patient, call any raw material or semi-finished product in the production line. The system is modeled with 6 letters, symbols or symbols in the form of MM1, FC, and an infinity. Basic characteristics. Queuing theory is a mathematical study of waiting lines or queues. Queuing theory deals with the queuing models as a branch of operation research. Generally, it is frequently used in the enterprises, in the decision-making process of service provider resource needs for units. The main purpose of queuing theory is to create an analytical or mathematical model for the service needs of the units and to estimate the queue length and waiting times with this model. The basic characteristics of a queuing system are made up of various factors. Some sources state that it consists of 4 factors: arrival process, service mechanism, queuing discipline, and system capacity. According to some other sources, the process of reaching the service of the units, the behavior of the units, service times, service discipline, service capacity, the number of service channels, the number of service stage, and it is stated that it consists of factors such as waiting area. Units come to service channels whenever they feel a need. If the service channel is empty at that moment, they can get service. Also, if it is fully, They wait in line. A simple queuing model is represented in figure 1.1. Arrival or input process. Input process refers to units that come to see the service to reach the system and enter the system. For example, patients, phone calls, and vehicles waiting in the service are among the elements of the input process. The other one is service mechanism. The service mechanism, which expresses the activities requested by the units coming to the system, varies according to the nature of the activities. In order to determine the service mechanism, it is necessary to know the points and the places where the units are served, the number of units served at the same time, the service time intervals offered, and the average number of the units served in a certain time units. The other one is system capacity. A system can be of finite or infinite capacity. In a system with infinite capacity, the queue in front of the service point can be of any length. The other one is queuing discipline. Expressing the order of the units coming to the system and waiting to see service, queuing discipline is an important factor in the analysis of queuing systems. Commonly used queuing discipline is first in, first out, or first come, first service. Queuing discipline refers to rule according to which the next unit to be selected will be put into the service. Performance measures in queuing theory. Distribution of waiting time and the time spent in the system. The time spent in the system is the sum of the waiting time and the service time. The distribution of the number of units in the system, waiting and serving units. Distribution of the amount of workload in the system. This is the sum of the service times of the waiting units and the increased service time from the units receiving service. Distribution of service station busy time. This time period includes the time that the service station is running continuously. These are the operational characteristics of a steady-state queuing system. Can be calculated in the light of these assumptions using the formula stated below. The first one is lambda is equal to average arrival rate, average number of incoming units per time unit. The other one is mu. Mu is equal to average service rate, average number of units served per time unit. The other one is P is equal to average system utilization rate. L means average number of units in the queuing system. LQ means average number of units waiting in the queue. W means average time spent in the system. WQ means average time in the queue. Pn means probability of n number of the units in the queuing system at any time in the time. Here, the service rate must be greater than the arrival rate. Otherwise, the tail may grow excessively. Therefore, it should be ensured that this requirement is met before using the formulas and models. Poisson distribution. This probability distribution was developed by the French mathematician Simon Poisson. This distribution is one of the most important statistical distribution with 4 or 5 distributions. One of the reasons why it has this importance is that many natural and experimental phenomena can be explained by this distribution. According to this distribution, the random variable x expresses the number of events that occur in a certain time interval and a constant rate. The number of conservations made in an hour at PBX, the number of occupational accidents in a factory in a month, number of misprinted pages in a book. Poison distribution is also used to determine the distribution of arrivals to a service point per a unit time. If the average arrival rate does not change with time, the arrivals are said to confirm the Poisson distribution. Exponential distribution. Generally, the formation of queuing states shows the characteristic of randomness. In other words, the queue is formed by a random unit arrivals. Randomness refers to the time independent of the occurrence of an event from the occurrence of the next event. The time between random arrivals and service times are expressed quantitatively with an exponential distribution for queuing modeling. The exponential distribution has a relationship between the Poisson distribution. If the probability of occurrence of an event fits a Poisson distribution with means lambda, it can be observed that the time between successive occurrences also fit an exponential distribution with mean mu is equal to 1 over lambda. Relationship between Poisson distribution and exponential distribution. Most commonly used stochastic queuing models assume an exponential distribution of time between arrival, service time, or a Poisson distribution of arrival rate, service rate. If the number of arrivals during t is Poisson distribution with lambda t parameter, the time between arrivals with lambda parameter is exponential. If the service time distribution of a system is exponential, the number of units served by the system shows a Poisson distribution. In other words, if the units served show a Poisson distribution with an average nu, the service times offered to the units show an exponential distribution with an average of 1 over mu. Because the exponential distribution is a result of the Poisson distribution.